Let me ask you something. How many times this week have you gotten up to use the bathroom and then had to go again 20 minutes later? And when you do go, does it feel like your bladder is never truly empty? If you're a man over 50, you just nodded your head, maybe even twice. Here's what most men don't know. By the time you notice the symptoms, your prostate has been quietly changing for years, sometimes decades. The prostate is a small gland, about the size and shape of a walnut, sitting right below your bladder. And every single man will experience prostate changes as they age. That's not a question of if, it's a question of when and how severe. Here's what stopped me cold in my clinic. I've seen men in their 50s with prostates functioning like men in their 80s, and men in their 70s with perfectly healthy prostates. The difference isn't luck, it's habits. The choices men make every single day are either protecting their prostate or slowly, silently destroying it. My name is Dr. Chloe, and I'm a urologist with over 10 years of clinical experience focusing on men's prostate health. Today, I'm going to walk you through the 7 most common mistakes I see men making every single day. Mistakes that are directly linked to prostate enlargement, inflammation, and even higher cancer risk. And here's what most men don't expect. None of these mistakes feel dangerous. They feel completely normal. That's exactly why they wreck so many men. Watch until the end, because mistake number 1 is the one nearly every man in my waiting room is guilty of. But before we dive in, if you find this information valuable, please hit that like button. It helps this channel reach more men who need to hear this, and subscribe if you haven't already. Every week, I share insights that could change the trajectory of your health. Now, let's get into it. Coming in at number 7, the midnight bathroom trip that you've normalized. Most men over 50 wake up once or twice a night to urinate, and they just shrug it off as getting older. But here's what I need you to understand. Getting up once or twice to pee at night is not normal. It's a symptom. Your body is telling you something is changing with your prostate. When the prostate enlarges, it presses against the urethra, the tube that carries urine out of your body. This pressure means your bladder has to work harder to push urine through a narrowed passage, so it doesn't empty completely. That's why you feel the urge again and again. Here's what most men miss. Every night of poor sleep from these bathroom trips is compounding. Poor sleep raises cortisol. Elevated cortisol increases inflammation, and inflammation feeds prostate enlargement. It's a vicious cycle most men never break. The practical sign is this. If you're waking up more than once a night, or if you feel like you still have to go even right after urinating, that's your prostate asking for attention. The solution isn't complicated. Limit fluids 2 to 3 hours before bed. Empty your bladder completely by waiting a moment after you finish and trying again. That's called double voiding, and it actually works. And please, if you're waking up twice or more every single night, schedule a prostate check. This isn't something to ignore. But nighttime bathroom trips are only number 7. What comes next is the mistake most men commit every single day. Number 6 is something you probably eat every single day without thinking. It's the inflammatory diet that's feeding your prostate problems. Here's the biology. Your prostate is extremely sensitive to inflammation. When you eat foods that trigger systemic inflammation, your prostate tissue becomes swollen and irritated. Over time, this chronic inflammation drives prostate enlargement and increases cellular changes that can lead to more serious issues. The worst offenders. Red meat cooked at high temperatures. That means well-done steaks, grilled burgers, charred barbecue. When meat is cooked at high heat, it produces compounds called HCAs and PAHs. These are inflammatory agents that concentrate right in your prostate tissue. Dairy fat is another major trigger. Whole milk, full-fat cheese, butter. Multiple studies show men with high dairy intake have higher rates of prostate enlargement. And here's the one most men are shocked by. Processed foods with omega-6 oils. Vegetable oil, corn oil, soybean oil. The typical American diet is overloaded with omega-6 fatty acids. This creates an imbalance with omega-3s, driving inflammation throughout the body, including the prostate. The better approach. I'm not saying never eat meat or dairy. I'm saying be smarter about it. Choose grass-fed beef. Cook it at lower temperatures. Limit dairy to 1 or 2 servings daily and opt for lower fat options. And here's the simple swap that makes a massive difference. Replace processed seed oils with olive oil, avocado oil, or coconut oil. Your prostate cells will thank you. But diet is only number 6. The next mistake is one I see constantly in my office. Number 5 ties directly to what we talked about in the habits video. Sitting for hours every single day. If you're an office worker, a driver, or someone who spends most of their day seated, listen carefully. Prostate health is deeply connected to circulation, and prolonged sitting is one of the worst things you can do for blood flow to the pelvic region. Here's what's happening inside your body. When you sit for extended periods, pressure builds directly on the prostate gland. Blood vessels in the area become compressed. Circulation slows. This creates a perfect environment for congestion, inflammation, and fluid buildup in the prostate. I see this constantly in my practice. Men who work desk jobs in their 50s often have worse prostate symptoms than men who retired from physically active careers. The fix is simpler than you think. Stand up every 30 to 45 minutes. Walk for 2 to 3 minutes. That's it. Take phone calls standing. Use the stairs instead of the elevator. Park farther from the entrance. These micro movements keep blood flowing to the prostate and dramatically reduce congestion. And if you do sit for long periods, use a cushion. A donut-shaped pillow or a cushioned seat reduces direct pressure on the prostate. Standing and moving is medicine. Don't underestimate it. But the next mistake is even more important. This is one most men over 50 have no idea is damaging their prostate. Number 4 is a silent epidemic among men over 50. It's zinc depletion. Here's why zinc matters so much for the prostate. The prostate contains the highest concentration of zinc in the entire male body, higher than any other organ, higher than your bones, your muscles, anything. Zinc is absolutely critical for prostate cells to function properly. It regulates cell growth, controls inflammation, and protects against oxidative damage. Here's the problem. As men age, their ability to absorb and retain zinc decreases. Add in a standard diet of processed foods, and most men over 50 are zinc deficient. But here's what makes this a prostate mistake specifically. Every time you ejaculate, you lose zinc. Your prostate uses zinc to produce seminal fluid, so regular sexual activity actually depletes your zinc stores. The body's wisdom. Your body knows this. That's why it stores zinc selectively in the prostate, like a reserve tank. But when depletion outpaces intake, the prostate starts struggling. Signs of zinc deficiency include frequent infections, slow wound healing, changes in sense of smell or taste, and specifically for prostate health, increased urinary urgency. The solution: pumpkin seeds, oysters, grass-fed beef. These are zinc-rich foods you can add to your diet today. But here's a crucial warning. Don't supplement zinc without testing first. Too much zinc can actually interfere with other minerals your prostate also needs. Get tested, then supplement strategically. Now let's talk about the mistake I see most often in my waiting room. Number 3 is the mistake that breaks my heart every single week. Men waiting years, sometimes decades before getting their prostate checked. I hear it constantly. Oh, I just figured it was normal for my age. I'm not ready to have someone poking around down there. It's probably nothing. Here are the numbers that should terrify you. 1 in 8 men will be diagnosed with prostate cancer in their lifetime. But when caught early, the 5-year survival rate is over 99%. The problem is that early prostate cancer has virtually no symptoms. By the time symptoms appear, the cancer may have spread. A simple PSA blood test can detect prostate changes early. Combined with a digital rectal exam, this is your best defense. I recommend baseline screening at 50 for average-risk men, at 45 if you have family history, at 40 if your father or brother had prostate cancer. This takes 20 minutes that could add years to your life. Please, don't be the man who comes to my office with advanced prostate cancer when we could have caught it years earlier. This is not optional. This is not embarrassing. This is survival. Now let's move to mistake number 2. Number 2 seems counterintuitive. Most men over 50 drink less water because they think it will help them pee less. It's exactly backwards. Chronic dehydration is one of the most damaging things you can do to your prostate. Here's why. When you're dehydrated, your urine becomes concentrated. This concentrated urine irritates the lining of the prostate and the urinary tract. Over time, this chronic irritation causes inflammation and swelling. Think of it like rubbing sandpaper on sensitive skin. The more concentrated the urine, the worse the irritation. But here's the second problem. Concentrated urine also encourages the formation of crystals. These crystals can accumulate in the prostate and contribute to enlargement and discomfort. Many men deliberately avoid drinking water before long car rides, meetings, or social events to prevent bathroom urgency. But the resulting dehydration causes far more prostate problems than the occasional bathroom trip ever would. The right approach. Drink half your body weight in ounces of water daily. A 200-pound man needs about 100 ounces of water. And spread it throughout the day. Don't chug it all at once. If you're worried about nighttime trips, front-load your water intake to the morning and afternoon. Your prostate will function better with consistent hydration all day long. Now, the number one mistake. This is the one I want you to remember above all else. The number one mistake men over 50 make with their prostate is avoiding sexual activity due to prostate symptoms, or avoiding it because they think it might cause harm. Let me be crystal clear. Sexual activity does not harm the prostate. In fact, regular ejaculation is one of the best things you can do for prostate health. Here's the science. During ejaculation, the prostate produces and releases seminal fluid. This is the gland's natural function. When men avoid ejaculation for extended periods, the prostate fluid stagnates. It becomes thicker, more concentrated, and prone to congestion. Think of it like a river. A river that stops flowing becomes stagnant and dirty. A river that flows regularly stays clear. Multiple studies support this. Research published in the Journal of the American Medical Association found that men who ejaculated 21 or more times per month had a 31% lower risk of prostate cancer compared to men who ejaculated only 4 to 7 times per month. Let me say that again, 21 times per month. That's the difference between regular function and significantly reduced risk. The practical reality. Many men over 50 experience some decline in sexual function. Performance isn't what it was at 30. Instead of addressing this or talking to their doctor, they withdraw from intimacy entirely. This withdrawal causes prostate congestion, which worsens urinary symptoms, which makes intimacy even harder. Another vicious cycle. My prescription: maintain regular sexual activity, whatever that looks like for you and your partner. Don't abandon this aspect of your health. If you're experiencing erectile difficulties, talk to your doctor. There are solutions that work. If you're single, even regular ejaculation through other means has proven benefits. Your prostate needs regular release. This is not optional. This is biology. And here's what I want you to remember. Every mistake we've talked about today is reversible. Your prostate is remarkably resilient when given the right support. Let's bring it all together. Today we covered 7 prostate mistakes that men over 50 make every single day. Mistake number 7, normalizing nighttime bathroom trips. Mistake number 6, eating an inflammatory diet that feeds prostate enlargement. Mistake number 5, sitting for hours without moving, cutting off circulation to the prostate. Mistake number 4, ignoring zinc depletion and the role it plays in prostate function. Mistake number 3, waiting too long to get screened, when early detection saves lives. Mistake number 2, chronic dehydration that concentrates urine and irritates the prostate. And mistake number 1, avoiding sexual activity when regular ejaculation is protective medicine for your prostate. Here's the powerful truth. You cannot control your age. You cannot erase decades of past choices, but you can start today. Every single day you make a different choice is a day your prostate gets a chance to heal and function better. Drink water, move your body, ejaculate regularly, get screened, eat real food. These aren't complicated prescriptions. They're simple daily habits that compound into years of healthy prostate function. Your prostate health is in your hands, literally. If this video helped you, hit that like button. It helps more men find this information. And subscribe to this channel. Every week, I share insights that could transform your health after 50. Drop a comment below. Tell me which of these 7 mistakes hits closest to home. I read every single one. And share this video with a man in your life who needs to hear this. Your father, your brother, your best friend. Prostate health is not a topic men talk about openly enough. Let's change that. Until next time, take care of yourself. Your prostate is counting on you. This is Dr. Chloe. Stay healthy, gentlemen.